Thanks so much for that.
9:30, Health and Human Service Committee meeting for Wednesday, October 12, 2022. And the first thing on there is public comment. Is there it? Come on up.
Teresa White, Robinson Township. My comments again regarding coordinating councils. In 2013, these councils are no longer state mandated, yet Ottawa County is working on hiring a part-time director to prepare for these committee meetings. If there is no state mandate, I am wondering how is a funding source behind this? Because I wouldn't think people work for free. The reason I bring these up is I believe these are community organizing operations targeting certain areas and populations. But now I see that in the rules for Ottawa County Board of Commissioners that needs to be signed in November 2022, I read that this committee, the Health and Human Services, shall receive reports on substance abuse from Lakeshore Coordinating Council. So it appears this entity was never shut down by the past administrator, possibly never even audited, like he mentioned in past minutes. Auditing means that money has been going through this council. I believe we as citizens, especially the families of children with special needs, need much more transparency of what has been built here in Ottawa County and why the system does not seem to be focused on helping the most challenged among us. Thank you.
Thank you, Teresa. Any other public comment from anyone? Anybody online? No. So far, we only have one person online.
Oh, yeah,
Okay. Then we're gonna go on to the consent items. Do I have a motion for approval of the agenda? Support. All in favor, say aye. Aye. Same sign for no. Second one, do I have a motion for approval of the minutes from September 14, 2022? So moved. Support. All in favor, say aye. 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 Same sign for no. Thank you. Action items, none. Discussion items. Tamara Drake, Ottawa County Department of Public Health Clinic Supervisor. Tamara, I'm just another thing I thought of. Did you take any samples of bugs along with you?
I didn't, I have,
Pass around.
they're called giant microbes, and I have a giant tick and a giant Borrelia burgdorferi, which is, yeah, I have them. They're little stuffed animals I was gonna bring.
Yesterday, we had a little stuffed Ebola virus.
Yes, I brought my Ebola virus, so
Yeah.
I did not bring any
Okay.
samples.
If I could just give a quick intro to Tamara. Tamara's work happens so often behind the scenes. She and her team have just through COVID worked tirelessly to serve the community. Gazillions of hours taking care of folks, receiving phone calls, doing all of the COVID stuff. But people on the outside are so familiar with COVID because it was in the news so often, but there is so much more that goes on, and she'll probably talk about it, but there's over 100 communicable diseases that are reportable, that are required to be reported through the state into our department that we have to follow up on. And this is what Tamara's team does. It requires a great deal of expertise and knowledge and commitment. And I just want to take a minute just to praise Tamara and her team. And, even in the last few weeks, we've had monkeypox virus, we've had S-Tech, and now we're going to talk a little bit about Ebola probably afterwards. But, it's an ongoing and very, very important, and not to mention tuberculosis function of the health department. So go ahead. Thank you for letting me.
Thank you, Lisa. Yes, Lisa's right. The last few years have been very COVID focused, and I'm really excited to present something different today. Something that's been, that we always do is routine, and but it's really important. These two particular diseases have a huge impact on our community, and so I want to talk a little bit about those today. Thank you for putting that up. Let's see if I can make it work. we go. So the first disease I want to talk about is Lyme disease. And I know that Dr. Heidel probably talked to many of you about Lyme disease in the past. But it's important because we have seen a fairly substantial increase in cases recently. And so I wanted to bring it back around and talk a little bit more about what's going on with Lyme in Ottawa County. I realize I only have 10 minutes to speak, so and my PowerPoint's probably way too long. So I'm going to kind of skip through some of these slides about the details of Lyme disease, but it is caused by a bacteria that's carried by the black-legged deer tick, seen in the picture here on a coin to give you some perspective on size. They're very small compared to what I remember as a kid. The dog tick is quite a bit bigger than these. So they are sometimes very hard to see when they're on you. Lyme disease can cause kind of flu-like symptoms to begin with: headache, fever, body aches. But most people are familiar with the bullseye type rash that develops, but that only develops in about 70% of the people. So you can still have Lyme disease without it. But again, you have some of these prodrome symptoms like fever, chills, and headache. If not treated and if it progresses to the later stages, there are some even more serious type complications that can happen from heart block, arthritis. In many of the joints, you can get Bell's palsy, which is a facial palsy causing droop on the side of your face. So here's some pictures of some of the rash. That you can see the bullseye rash there in the bottom, but it can also present in multiple rashes around the body. And then the joint swelling and facial palsy. I spoke a little bit before the meeting with Commissioner Dandenberg about the movement of Lyme disease across the state of Michigan. If you look at the dates on these two maps, I pulled these off the state website. And you can kind of see where it really followed the coastline back in 2014 and now has progressed across the state of Michigan. They're finding positive Lyme disease carrying ticks all the way across the state of Michigan. So, yes.
And we talked about, because Dr. Heidel then said they were contacting the vets, and the vets said all the ticks are west of 31. So that was the draw line. Well, that's not the case anymore. No?
It is not. Nope.
No
Nope.
problem.
No, they have moved eastward. So some of the numbers there: United States, 35,000 cases confirmed and probable in 2021. Most of those cases still remain out on the East Coast or kind of Pennsylvania, upper eastern US area, but we have moved into Minnesota, Wisconsin, Michigan here as well. 864 cases in Michigan in 2021. Nearly double of that the year before. This is the important slide I wanted to bring out. In 2021, we had 28 new confirmed or probable cases here in Ottawa County. That's 180% increase from the year before. There are a number of different things that could contribute to that. More testing, more diagnosis. We saw a lot of more outdoor activity in people during the pandemic. They were trying to get out, social distance, be outside in fresh air. Maybe people were out more. We don't know for sure what caused that increase, but it is somewhat alarming. Our numbers are down a little bit yet this year to date, but still seeing a fair number of Lyme disease cases being reported. What my team does with a Lyme disease case, like Lisa mentioned, actually there's 77 reportable diseases in Michigan, Lyme disease being one of them. So yeah, when we receive a report, usually it's a lab report from the hospital or lab that there's a positive Lyme antibody. We contact the physician and get a little bit more information on the symptoms, and then we contact the person who was diagnosed, and we do we review the symptoms again, but we do a travel history, because sometimes those people have traveled out east. Then we don't count it as necessarily an Ottawa County case, or we look at that information when we count them. And so does the state of Michigan. But so exposure history, a lot of people will tell me I've been hiking out in the tall grass near the woods, on the beach, certainly places where we find these types of ticks. And we try to find out. So there's a case definition that the CDC provides for Lyme disease. Not all cases that are reported to us meet that definition for reporting Lyme disease, but they may still be considered a case by their physician. And that's fine. That's up between the provider and their patient. But for reporting purposes, they have to meet a very specific case definition. And we have a whole algorithm to see whether they meet that. And then we make sure that they're on appropriate treatment. And provide education on how not to get Lyme disease again and prevent family members from getting it. So let's go on to the next one. So the next disease I wanted to talk about here related to Ottawa County is rabies and animal exposures. You've probably heard in the news about the increase in pets that were adopted during COVID. And so there are a lot more animals out there. We see a lot more animal bites. Animal bites come into us a couple different ways. They can come from animal control here at Ottawa County or the local police animal controls, like Holland has their own, Grand Haven I know has their own. They will report bites to us, as well as the hospitals and urgent cares that treat bites. So rabies is an extremely serious disease. It's probably one of, if not the most deadly disease as far as survival rates go out there. I believe there's only been around 20 or so known survivors of rabies in recorded history. But rabies is a virus that travels not in the bloodstream, but through the nerves and eventually to the brain, where it causes infection and ultimately death. Because of the seriousness of the disease, we, as the nurses in communicable disease, take it very seriously when we're calling someone who has a bite and a potential rabies exposure. Dog bites, most dogs are vaccinated, not all of them, but we also have bites from things like raccoons. I recently had a gentleman bitten by a raccoon that he had trapped. We have bites from other wild animals. It's usually an exposure in a trap situation. So we would call it provoked, but because we know those animals aren't vaccinated and can carry rabies, we have to proceed like it's a potential exposure. In Ottawa County, so this gives you a little bit of the stats of what we've had positive rabies. They've all been bats in Ottawa County. And since I've worked here, it's going on 17 years, all of our positive rabies animals have been bats. I don't believe we've had a dog in over 40 years that's been positive, and I'm not sure what the most recent cat is, but it's been a long time. So really, bats are our primary concern here in Ottawa County. So this year alone, we've had 3 positives. I just texted my team because I didn't work on any of these myself, but one was a bat found in a barn by a child. The other was a woman who was gardening and found the bat laying in the garden beside her. Doesn't know for sure if she was bitten, but she doesn't know for sure she wasn't. And all it takes is a bite or a scratch, and they have tiny, tiny little needle-like teeth. And sometimes we don't really know if they bit us or not. And the third one was found flying around in someone's bedroom at night. So, the next set of information there, rabies post-exposure prophylaxis. So these are people that we have advised to go and be evaluated for post-exposure prophylaxis, which is a rabies immunoglobulin shot and then rabies vaccine series of shots. So 36 people this year we have recommended go to their local ER for this preventative treatment. Again, we don't tell them they have to do it. It's up between them and their provider at the hospital. I think almost all of those persons were started, however, on treatment. So
is this the treatment that they feel that they might have been contacted
Yes.
with rabies, right?
yes,
So a couple things, the
Mhm.
price for that, is that still extremely high?
it's extremely expensive.
And
Yep.
most carriers don't cover it?
I don't know about that.
Okay.
We've had a couple people call us and just mention that, it's very high, but I haven't heard what insurance covers. I know there's a program through the CDC for coverage. We've never had to use it. I think we have directed a couple people to it, but
Which leads us to believe that it is covered by many
Some.
insurances.
yeah,
Because we've never, well, I would say never. I can think of one time where someone was like, we don't have insurance and we can't
Right.
afford this.
mhm.
Is there a time limit on how soon you
No.
you need?
There is not. Ideally within 10 days.
Okay.
But rabies has a very long incubation period, can be up to months. There's some records of possibly even up to a year. So as long as the person hasn't developed symptoms, it's not too late. So for instance, if someone came back from South America and said, I was on a mission trip and I got bit by a dog down there, it was last month, I would say start it now. I would
Okay.
send them to the ER right then. So. Yeah.
Okay, thank you.
So this is when we consider sending someone to the ER for evaluation. We do the rabies risk assessment. We want to know the species of the animal. We do get a lot of calls regarding bites from mice, chipmunks. Typically, those animals don't carry rabies, and prophylaxis is not recommended. It would be a very rare situation like the chipmunk was foaming at the mouth and it ran across the yard and bit me in the leg. That would be odd for a chipmunk. They don't really like to get close to people. That would maybe be something that we would consider and call the state about. But if it's a bat, a raccoon, a skunk, and it was acting odd and bit you, we certainly would consider that a high risk exposure. The endemicity of rabies in that particular species, and that's what I was saying, most rodents aren't considered a risk carrier. And then any observed behavior by the animal, like I said, a lot of these bites are provoked, but we also have to consider the species of the animal and whether they carry rabies, and then the circumstances of the bite. So this is the rabies prophylaxis recommendations. So rabies vaccine, like I said, we give the emergency room will give immune globulin and a first vaccine on the day they see the patient. And then usually they're forwarded, the patients are forwarded out to like a urgent care or a ambulatory treatment unit for the follow-up shot. So they don't have to go to the ER for all of the shots. Some primary providers will order it, but I've rarely run into that situation. They would rather it be handled by emergency or hospital. And there is a pre-exposure vaccination. The only place I know that does that, I think, is the travel clinic at Kent County. And that would be for persons who work with animals, wildlife biologists, veterinarians who are just at high risk for bites because of their occupation. So over 100 individuals were evaluated last year for rabies prophylaxis, post-exposure prophylaxis. Like I said, we receive our bite reports from urgent cares, emergency departments, animal controls, or the residents themselves. We evaluate their rabies risk. We refer them to Harbor Humane. We have a contract with them for doing euthanasia of the bats. The bats can't be sent to the state alive. They have to be euthanized before we send them to the state for testing. And then refer the patients to the emergency department if they need post-exposure prophylaxis, provide them education on rabies, and follow up to confirm that the post-exposure prophylaxis has been completed. So we kind of go in every few days on that schedule of 0, 7, and 14 days and make sure they actually got the vaccine, and they got the vaccine on schedule. I did have a gentleman who received 2 of his doses off schedule, and then we were advised by the state to draw a titer, an antibody titer, to make sure he actually did develop the immunity that he needed, or the antibody that he needed. So before I go to questions, I wanted to bring up a couple other topics that came about after I made this PowerPoint. One is TB. I just wanted to mention TB. We do have 1 active case in the county right now that we are treating. He'll be done in December. And then today is our TB clinic, where we have people who've been exposed to TB and have TB infection come in, are evaluated by our contract physician, Dr. Petrolia, who's an infectious disease specialist at Spectrum Health, to start them on preventative treatment for TB. And then lastly, September 20th of this year, the Ministry of Health in Uganda declared an outbreak of Ebola. Last Friday, the CDC made an announcement that they would be screening all travelers coming from Uganda into the United States through designated airports, and then notifying the local public health in the area or jurisdiction that they were going to come to. We have already received 1 traveler from Uganda. I spoke with this person on Friday. They are at low risk for Ebola, but we do monitor them for 21 days. There are different risk levels for monitoring. Some requires daily monitoring, but this particular individual was considered low risk, had only been in the country, not in a district known to have Ebola at this time. So that is what we're also working on at the moment. So now any questions?
Any questions? No, I don't either. We touch base with the Lyme disease and stuff like that. So, but I thank you for your presentation.
Absolutely. Thank you so much for having me.
Yep.
Thanks, Tamara.
Okay. Department updates. We're gonna start with, let's start with Gwen online.
Well, once again, Tamara stole my thunder. She had so many diseases of the month. There are none left for me to talk about. So really, right now the health department is sort of just cruising, business as usual, I would say. I hesitate to say that too loudly because you never know what new disease is going to pop up next. But I would just once again like to echo what Lisa said about just how amazing our behind the scenes teams are. Just like I said last month after the presentation about the E. coli outbreak, it's one thing to be a doctor out in the community and know that, yeah, there's that building over there where they're kind of taking care of all those diseases for us. But this past year of being here and being a part of that team has been one of the best years of my medical career. So I would just like to use my update to give a shout out to all of our teams and say I am so happy to be here working with them. So thank you.
Thank you, Gwen. Since we're online yet, why don't we jump right to Kendra?
Good morning. Sorry, I can't be there in person. I had a meeting right before this, but I don't really have much to update, except I wasn't available to attend in September. And we found out at the end of August that we did receive 4 positions through the legislature for Pathways to Potential, which is our individuals that are at our schools. So we already had 3 in place and we are in the process of hiring the 4th one and evaluating the needs. There are 3 schools that we are looking at as possibilities based on the areas of economically disadvantaged, homeless population, and truancy, expulsion, and graduation rates. So we will be making that decision shortly after we do the selection for a staff. So very excited about that opportunity and that the legislature also agrees that the program has been beneficial. So other than that, Medicaid, we don't have any dates yet. Food assistant extension, we don't have any dates yet. So once I do, obviously I can share that information, but we're just in a holding pattern and continuing to provide the same level of service. Thank you so much.
Thank you, Kendra. Any questions for Kendra? Okay, next, Jennifer.
Good morning. So for Community Action Agency, excited to share that we're fully staffed. We're going from a whopping 6 staff members to 7. So we're really excited about that. So we're ramping up for the funding that we just received. I know I've been talking about it for the last few months. We did receive the large grant for our weatherization program, which provides an extra $670,000. That's just for this year alone for weatherization. So we're looking to weatherize, it's going to be about triple the number of houses that we've done in years past. So that's really exciting. So we'll be looking at more contractors to do the work. We'll be looking at having some individuals come on contractually to do the pre-inspection and the post for the quality control aspect of it. So our new staff member, our program coordinator who we hired at the end of August is actively working on getting contractors on board so that we can get that work done. So we're excited about that. We also were awarded a grant through MISHDA, which is called My Hope. And that is a $200,000 grant that will help us with, again, with weatherization. So these would be homes that maybe otherwise could not be weatherized because maybe they had a leaking roof or other home repairs that needed to be done, but the family members didn't have the money to get those repairs done. So that grant is going to allow us to be able to go into those homes, get the repairs done, and then get the homes weatherized, which is very exciting. And then lastly, another new project for us, we're working with the Holland Board of Public Works and City of Holland. They joined forces and developed a home energy fund. And this program will provide home energy consultations in the home. So our weatherization inspector will go into the homes, do some education, and then have homeowners learn about different, cost savings methods that they could do in their homes, whether it be switching out light bulbs or turning off lights and just trying to lower their utility bills. And then with that program, once they've received the education, then they'll get a box of supplies that they can either contract out or they could do some home energy efficiency measures in their homes themselves. So we're excited for all of these new programs.
Looking for the contractors.
Yes.
I saw something online about Home Depot working
Mhm.
out of Florida. And they're asking all their support stores if they know any contractors that want to go down to Florida. And I'm thinking that's during the winter months, so.
Right.
Has she had any trouble? Is she getting some contractors?
We're gonna change our approach. We had thought about doing a large open house, but other counties we're learning have had some success in just doing cold calls to maybe like an installation contractor in town, inviting them in. So we're pretty new. So to answer your question, we haven't had the luck just yet, but we're kind of just starting since we just have a new staff member trying to learn the program. So I'm hoping next month I'll have a different answer
Okay.
for you.
Okay, thank you.
Yeah.
Any questions for Jennifer? Okay, Lynn?
Good morning. We continue to be really busy. We have had some luck hiring staff, but we continue to have difficulty with programs like our crisis team. They're always hard to fill right now. They've been vacant, some of these positions for months and months. So we have met with human resources and we're going to try some different approaches to recruitment. So hopefully that will work. Another place that continues to struggle finding staff is with most of our contractual agencies who employ direct care workers. I've mentioned that multiple times in here. I think it's worth keeping upfront as an issue that we should all be aware of. They continue to struggle with recruiting staff. It seems like every time they are able to raise their wages, the other entry level organizations, businesses also raise their wages. So it feels like we're constantly chasing our tail. We have devoted over $1 million of millage funds to help with those issues of recruiting, retaining staff, paying for overtime. They've all have huge overtime budgets because they can't find enough staff. So they're paying current staff to work additional hours. So that's one area that through millage funds, we're able to support them. It would be really nice if the department would increase the direct care worker pass through its dollars that are coming to the CMHs with the expectation that it gets spent or those dollars get passed through to the provider organizations for their workers. The pass through has been $2.35 for the last 2 years. We really hoped that with this year's budget, they would increase that, but the legislation did not. So there's a lot of advocacy still out there trying to get the word out and an understanding of how big of an issue this is. Another area, I've mentioned that the request for services for our programs has really stayed high and steady. One way we're trying to address the ongoing need for mental health services, counseling services, therapy services. We're in just the beginning stages of starting a new community partner program. We're going to be working with 7 of our local human services and mental health provider agencies to provide additional counseling and treatment outpatient for mild to moderate mental illness. The hope is that we will be able to have a better warm handoff. So if someone comes to us or they call for services through our agency and they're not eligible for our services, that we will be able to very quickly make that referral and get people in as soon as possible for treatment. So though the funds for that program are also coming from millage savings. And we know we can pay for those services through 2023, hopefully 2024 as well. So, thank goodness, honestly, that we have that millage. It was sought so that we could fill the gaps in places where Medicaid and state general fund was not able to pay for, or we didn't have the funds. So I think we're using those funds wisely to get as much service out to the community as we can possibly get. So I'll leave you with that unless you have any questions.
I got one. Go back to your pay. What is the pay and that's for the group homes? Did you say?
Yeah, it's for direct care workers who provide specific services. Residential is one of them. Community living supports is another one.
Okay. And what's the pay for that?
On average, in a residential group home, staff are paid anywhere from $14 to $17 an hour, and that includes that $235.
Okay. And you said you were hoping the legislature would have put more money in the budget. And they didn't do that.
They did not increase the $235.
Does the 3 of them, I guess now we lost one. Sla and Victory and Merriman. Do they know about that?
They do. I've talked to them multiple times throughout the years about the problem with really a crisis we have with drug care workers and the need to elevate their wages to a point where it is truly a livable wage. People stay with that as a career. But I have it in my to-do list to give them a call each to remind them about how important this issue is.
Okay. Thank you, Lynn. Patrick?
Yes. I thought today I'd update a little bit on Housing Next, which I don't think I've talked about in quite a while. I think everyone's aware Ryan Kilpatrick, who is the director of Housing Next, is in a process of transitioning into a new role. We're incredibly grateful that Ryan has stayed on at least through the end of the year to help with some of the ARPA related activity, but most of his time is being focused into Kent County at this point. But we've been spending a lot of time on Housing Next recently, because if you go back several years ago, we launched Housing Next as a collaborative effort to help increase workforce housing in Ottawa County. And it was designed originally to be a 5-year go at it. Like let's inject some resources, let's get some talent in here to help just increase workforce housing in Ottawa County, with a goal of being a 5-year project. And so Ryan's leaving came a little bit before we hit the 5-year mark, but the board of Housing Next came together and said, well, what do we do? Are we going to continue this effort? Are we not? So we contracted with a couple community developers, Harry Khan, Greg Holcomb, some familiar names in the area, to really just go on a listening tour and talk to businesses, talk to local municipalities, talk to housing developers, talk to nonprofits, a wide variety of folks, and said, hey, is Housing Next something that our community needs into the future? And if so, what are some things we should pay attention to? The kind of overwhelming response was yes, this has been a successful effort. We've increased the number of workforce housing units in Ottawa County. We think it should continue with a couple caveats. One was to the business community really needs to take a deeper ownership of this. When we launched this effort a number of years ago, we said this is a business issue. We heard from plenty of our major employers that they're trying to recruit people, but there's just not housing supply for their workers. We're hearing that message 3-4 times what it was even 5 years ago. In fact, Lakeshore Advantage would say the top 2 business issues right now are childcare and affordable housing. You would not think that those are traditional human services issues. Those are now economic development issues at a pretty big scale. And so we're working on how do we shift some of the ownership of Housing Next into more of businesses taking ownership of that, the chambers, Lakeshore Advantage, stepping up hopefully to take more leadership in that capacity. So right now we're talking about kind of hiring for Ryan's replacement. What does that look like? What does a staffing structure look like into the future? One of the other kind of changes that we'll focus on with this next iteration of Housing Next is getting more upstream in terms of the development process. So Housing Next has been very influential over the last couple of years. When a developer decides to come into Ottawa County and says they want to build some units, then Housing Next can help be kind of an intermediary between the municipalities and the developer. What we're saying now is we got to go out and start recruiting developers and working a little more proactively to getting them into the community. 5 years ago, we didn't even really have developers that wanted to be in Ottawa County. But thanks to some of the housing studies that we've done over the last few years, we have had more developers that are interested in coming here. So that's just a little bit of an update. We're in the process of, again, looking at that staffing structure. How do we continue this effort moving into the future? But kind of the overwhelming response of the communities of local municipalities and their planning departments is this has been helpful. This has helped improve zoning codes. It's helped attract developers. So, and as much of a difference I think we've made by adding a couple thousand units over the last few years, we know that the challenge hasn't gone away. So that's the main thing I wanted to highlight for today.
Thank you.
Mm-hmm.
Any questions, Patrick? Lisa.
Okay, the few things. One that I'm super excited about is we received an $800,000 grant to expand our sustainability programming. This $800,000 is a collaboration, as almost everything we do. The collaborative part comes in with Grand Valley State University, who is actually donating the property that this new center will sit on. We're calling it a hub because we know that we've got other centers around the county. And this one, I'm going to call it a premier center because it will serve a purpose beyond collecting the household hazardous waste and other materials that we're trying to keep out of the landfill. It will also serve as an education center, which is something that we've been wanting to do for a number of years, where we can engage the community more in the sustainability of our community and our environment. And so it's likely, well, I don't know if I should say likely, it's likely that we will be soliciting or applying for additional grants, especially since we do want this to be a premier center. And the $800,000 grant will only go so far. But we'll certainly keep you updated on that. And again, it provides additional opportunities for community members to get involved in environmental sustainability, which I think is a really important thing for all of us who live in this absolutely amazing and beautiful Ottawa County. So more to come on that. I don't want to bring up COVID, but I just have to say that we're monitoring things right now. We continue to have cases. Thankfully, because of vaccination and some of the really effective treatments that are out there right now, Our death rate has not gone up, but we are going into a season where we could have a double whammy because experts are saying that it's going to be a tough flu season. Patrick and I just heard last week on the Spectrum board that they are also, the hospital systems are planning for a very tough flu season. And we could have a convergence. So it's COVID, it's flu, and it's also a shortage of staff. And I know Lynn's talked extensively about that. That's also happening in the healthcare space. It's been a really tough couple of years on nurses and physicians and really all people working in the hospital setting. So stay tuned. We're ramping up and really trying to keep our eye on that and make sure that we're prepared. Let's see. Another thing about funding that's really good. I don't have an exact amount, but as you know, we get an allocation from the state. It's our state grant. It's called ELPHS, which stands for Essential Local Public Health Services funding. This is what goes to fund all of the mandated programs that are provided at the health department. It rarely gets increased. We've seen tiny little increases, maybe 2 times over the past 25 years. This week, we were notified that on the environmental health side, we are going to see an increase in that funding. And, you know, we're just happy with any additional funding that we can get our hands on because we're financially strapped. The pandemic brought in quite a significant amount of funding for our department, but because our response all went to COVID, that resulted in some additional funding for our traditional programs and services to go down. And without getting into too much detail, those funds come in a delayed process. So for example, if our services were down in 2021 or the funding was down in 2021, we wouldn't see that in our budget until 2 years later. So projecting forward, we're gonna be in a little bit of a hole for the next couple of years. So obviously more to come on that. We're working with John and Karen and trying to, again, bring in grants and do other things that really help us to maintain and sustain the really important programs that are provided through our department. I think that probably covers the most important things for today. If you have any questions, I'm happy to take those.
Any questions for Lisa? No.
Okay.
I got a couple for you.
Okay.
The sustainability center, cycle centers, they advertise that they'll take electronics, and I've dropped off TVs and stuff, but do you know, will they take like printers and copy machines?
I don't know, Joe, but I will find out and I will shoot you an email. So you're interested in computers, monitors, printers. Okay, I'll check out that and let you know. You know, one of the things that's going to be pretty cool about this new site is that we're hoping to expand some of the things that we're not able to take now. And one thing that Addie, our EH director, brought up was mattresses. Apparently people have a really hard time getting rid of mattresses.
$100 you can get rid of it.
Yeah. And so we're trying to figure out, we're hearing from the community, and like we always do, we try to figure out how to really meet those needs. Sometimes it's possible, sometimes it's not, but we hear the community and we're working on it. So, and I will let you know on the computer stuff. Thank
The
you.
other question I've got is, you had mentioned, flu and COVID. Is it smart to get a flu shot and a COVID booster at the same time?
That is allowable. And I am going to, Gwen, if you, I'd prefer for you to take this question if you don't mind. Just, I want to give the right info.
So the question was, is it smart to get the flu and COVID booster at the same time? Yes, in a nutshell. If you are due for your COVID booster, and that is with the new booster, as long as it's been 2 months since your last COVID vaccine dose, you can get the new COVID booster. And it is perfectly acceptable to get that at the same time as your flu vaccine. Very convenient. And now is the time. October is usually the time where we say, you know what, time's running a little low for your flu vaccine. We still encourage people to get it all through flu season, but October is usually the time where we really want people to make sure that they're getting it before flu season really ramps up, because it does take a couple weeks for you to develop that optimal immunity. So yes, please do get those vaccines.
Okay, thank you.
Black River Recycling takes them.
But what do they charge?
As far as I know, I never saw them charge anything for that. They just got a great big bin of all electronic stuff. They throw it in there. I don't think you get anything for it. So,
Okay.
but they will get rid of it.
There's some place to dispose of.
Yeah, I did get a booster shot last week, Thursday, and a tetanus shot.
Oh, very good.
Yeah, tetanus shot was by far the worst side. So,
Yeah, your arm hurts from that tetanus shot. Uh-huh.
yeah. So anyway, okay.
Usually on a mattress, you buy a new mattress, they take your old.
Yep,
mattress.
yeah, Jim, you're right on that.
Or you can throw it in Al's front yard. Then it's his problem. But I called my doctor on the shots and he said, get them. That's usually what happens. They just throw them on the road, along the road somewhere.
Oh, Al's front yard, that's funny.
You know, I sold a house and they left 3 mattresses
Oh,
in a house, and you know, they were gone, the seller's gone, and the buyer's agent saying, you gotta get rid of them.
Oh,
So you
no.
took them home with you, put them in your.
No, I just wrote out a check and said, okay, that's part of business. So,
It's amazing what $100 will do.
yeah, that's right.
Yeah, used mattresses, I mean, if you know the person, I suppose that could be a good thing, but yeah, you don't want to get a used
You
mattress.
ask somebody, say, would you sleep on a used mattress? Oh, no.
Yeah,
See,
It's like
so-
wearing dirty socks,
Yeah.
you just don't
Oh,
do that. Somebody else's dirty socks.
Yeah. So, anyway, thank you all. Any other questions? Then we're gonna jump to the second time public comment. Any other questions or for public comment?
I have another question.
Yes,
I want to ask John. On the question from Teresa at the start of the meeting.
Yeah.
Can you check on that for us?
Was this on the court?
Yeah, I wonder if maybe she could give some clarification,
Yeah.
especially in the part-time position, where,
Minutes. So the part-time position, that would have probably been working in 2013, 2014, it just started. Right after the mandate.
oh, so it's not a
Teresa,
new
Teresa.
part-time position,
Teresa,
it's
come on
one
up.
that was in
Come on up.
2013.
I wondered that too. I thought,
Okay.
okay, general, you're talking,
Okay,
you're
right.
talking general counsel for
Yeah.
the county.
so,
No, I'm
maybe-
talking, they took the mandates off at the state level
Okay.
back in 2013. And then, because this is what I spoke about last time I spoke here. Then it was nonprofit next had been talked about like the meeting before for you guys. And then the mandates came off, and then it came up that I believe it was Keith Van Beek, or the old deputy administrator. He started introducing the idea of hiring someone to continue on with these coordinating councils.
So, I think you're referring to my position, so,
Oh, I didn't realize that.
Yeah.
but,
Okay.
so, yeah, so formerly there was an Ottawa County Human Services Coordinating Council.
Yes,
There
that's
used to
what I
be-
started out asking
Yep,
about.
yep, so that used to be a state mandate, that mandate went away.
Yes.
So there is no Ottawa County Human Services Coordinating Council, but the idea of the work was to bring together health and human services organizations, both countywide and nonprofit, to help address and collaborate around health and human services. So in lieu of doing the coordinating council, which was no longer mandated, Community Spoke was created, which is one of the nonprofits that I run, which is an
Right.
independent 501c3 nonprofit. We are not a government entity.
Right, right. So then I don't think money was heading your way. So that's why I turned into looking at the Lakeshore Coordinating Council, because my interest is in where this Medicaid money is coming through to the county. I'm thinking it's coming through The Lakeshore, it was, and now it's kind of combined up with the regional council, what is that called? The Lakeshore Regional Entity. And I'm wondering why, well, this is an update. Why it doesn't just directly go to you. At some point in the minutes way back, it was directly going to them.
Teresa,
Yeah.
I might be able to provide a little bit of history if I'm.
Yeah, no, I'm a learner.
So just be perfectly clear, there is no more Ottawa County Human Services Coordinating Council.
Right, exactly.
Okay, so back then, the council did receive some money that came through the Department of Health and Human Services, so DHS. This was Kendra's organization.
Oh.
It was a very small amount of money. I think it was like maybe $15,000, not enough to,
Right.
do.
Or
but we-
foundation money came there.
To the coordinating council.
Yeah, because I've got a copy
Yeah,
of that
that
also.
Came later when it became an
But
independent.
you're saying Lakeshore Coordinating Council. So I think
This is a different council.
Yeah.
I'm just talking
Different.
councils in
yeah,
general.
so I think that's part of the confusion
That's-
is
yeah.
the term coordinating council is used
A
for a
lot.
variety of councils.
Right.
The coordinating council the Human Services Coordinating Council is the one that was no longer state mandated. I can't speak to the Lakeshore Coordinating Council, which you're right, was now
Right.
part of the LRE.
Right.
Substance use disorder services.
Right, because Medicaid money is coming in for substance abuse, and that's why I'm thinking the focus has come off of children with disabilities and stuff, and now it's shifting over very heavy into that
Mm.
entity.
To Lakeshore Regional Entity.
Yes,
I think that might
Yeah.
be where some of the confusion is.
Yeah.
Again. There are similar names.
no, I know that because I think right now, I think Commissioner Fensky has gone on to the board now of Lakeshore Regional Entity, and that entity took over Lakeshore Coordinating Council.
Right,
That's been combined.
right.
And I think a meeting or so ago, he was at your facility, he was just put on their board of Lakeshore Regional Entity.
Yes,
So,
correct.
right. I'm just saying they're all overlapping. That's what I started out as saying. They're all overlapping. We don't understand as parents of special needs children, this whole thing that got built. I don't mean to be confusing.
That's why I tried to.
Yeah, sometimes we're
Yes.
confused too. Let's just.
I think maybe we could undo some of this and start focusing on,
The Lakeshore Regional Entity.
yeah,
Started 7 years ago, okay, and that was supposed to be, that was from the state. We as Ottawa County pushed back a little bit of that because it was duplicating services,
yes.
but it's. We were losing money. Yeah,
Oh, yeah, they were millions of dollars,
Yeah.
$24 million.
yeah, it went other places.
Yeah, who knows where?
That's right. You're gonna have to contact
Yeah.
the governor's office.
Yeah, I just,
Control.
I'm only looking at trying to unravel some of this so that my granddaughter can get some services. That's
You know,
what I'm looking at.
Roger Victory should be able to answer a lot of
Right.
questions where that money went.
Mhm.
So-
Oh, that would be very interesting. So thank you for that.
Yeah.
Long enough to know that, yeah.
Cleveland.
Has he
So-
been? I'm just new to the game.
I
So,
know, so, yeah, reach out to Roger
Okay.
Victory's office.
But
Sounds
if your-
great.
If your focus is to get services,
well, I'm just going back to Harbor House. And what's great about the minutes is that Harbor House way back in the day was part of, I mean, they came up and talked to you guys. They were there, Peg Dreesinger, I guess she's been on your staff and everything. Where did that whole idea go? I don't know.
Peg,
They had a better
is
idea.
Peg still on the LRE?
No,
She's off because she's working for someone. That's-
right,
Yeah.
she's the director of a provider agency and they changed the bylaws to say
Yep.
that,
Conflict of interest.
yeah, there's a
Yeah.
conflict of interest there.
Yeah,
Okay, thank you very much. Thank you very much for that.
okay. No other questions? We are adjourned.